So today I'd like to discuss with you some of the more common reasons why we see patients for rhinoplasty consultations. There are a number of reasons why people may not be happy or satisfied with the look or the function of their nose. And so there's a number of major complaints that we see from people. One of the most major, number one, would probably be humps on noses. So this is the dorsum of your nose, and a lot of people have a bump or a hump on their nose that they want to get rid of. So we see those people, and there's a variety of techniques that we can use to get rid of it, but it depends on the size of the bump that people have, and if there's other factors with their nose that they want to change. But one of the more minimally invasive types of rhinoplasties that we do is what we call a bump shave, to get rid of a small little hump, where we just go in underneath the nostrils of the nose or in through the nose, and we shave down that bump. Other more big bumps that have to be treated have to require a little bit more invasive maneuvers in a rhinoplasty, and we'll do those in conjunction with other steps. So that's humps on noses. Another common complaint is about the tip. First of all, the size of the tip. Many people come in complaining their tip is too large, it's too broad, it's too wide. They want to make it smaller, they want to have a more defined nasal tip, and that often has to do with the underlying cartilages of the nasal tip. We have to do something to modify those cartilages, whether it's with sutures to tie those together in a more defined way, or actually removing some of the cartilage inside the nose to make them smaller. So there's a number of different techniques that we'll use to that, but we can address a person's nasal tip to make it smaller if it's too broad. Now, also with the tip, people will come in and complain that it's hanging down too low, or we'll often see patients who complain of when they smile, it gets pulled down. That's often because the nasal tip isn't supported enough where it needs to be so it will stay up. And so we need to do something often to strengthen the nasal tip to lift it up. That usually requires a little cartilage graft underneath the tip cartilages to keep it in place. Sometimes it also requires removing a little bit of bulk of that cartilage so it's not quite so heavy, but we can definitely lift a person's tip up if it's hanging down. Now, another thing with the tip is some patients don't like how far the nose sticks out. We call that projection of the nose. And when we want a deprojected nose, there's a few techniques that we do to remove some cartilage to bring it in so that it's closer to the plane of the face, and that's called deprojecting the nose. We often will see patients with a crooked nose from trauma or other factors. There's crookedness to the nose. We have to determine, is the crookedness up here in the bones, or is it down here in the cartilage of the nose, or is it a combination of the two? That will determine what we have to do to try to get it straight and keep it straight. So do we have to work with the bones or the cartilage or both on the nose? And sometimes it depends on what the instigating factor was that created the crookedness in the first place. The last thing that I'd like to mention that we see patients for quite frequently with rhinoplasty complaints is just the functional aspect. Patients will come in and say they can't breathe through their nose very well. And there's a lot of factors that can affect that. There can be physiologic factors or there can be anatomic factors. Surgery will deal with the anatomic factors. So if there's a crooked septum or if there's narrowness in the airway in certain areas of the nose, there's cartilage grafting that we can put in to help open up the airway so that people can breathe better. We can do a septoplasty on the inside of the nose to straighten the septum so a person can breathe better. And so we do a lot of that, and it's important to note that if and when you meet with us or any other surgeon that you're going to have a meeting with the nose, that you don't want anything to happen to the nose that will compromise the function, okay? And a good rhinoplasty surgeon will tell you when something might compromise, and they won't do that because no matter how good your nose looks, if it doesn't work properly, no one's happy. So I hope you enjoyed this. If there's questions that you have about your nose, please feel free to contact us. We'd be happy to see you. Even if you're not in our area, we can contact you and have a FaceTime or a Skype consult and talk about these things online and over the internet or over our phones, and we can help you out in any way possible. Thanks again.